Welcome to the COPD Foundation's patient testimonial video series, My Lung Health Journey, where real stories come to life. You will hear from individuals and their loved ones navigating life with lung disease, sharing their experiences, challenges, and tips for living well with lung conditions. In this episode, you will meet Diana Patterson. Diana is an individual living with Alpha-1 antitrypsin deficiency. Alpha-1 is a genetic condition that mainly impacts the liver and the lungs, and is also known as genetic COPD. Approximately 1 to 3% of COPD patients worldwide have genetic COPD, and only around 1 in 10 have been diagnosed.
Hi, everybody. My name's Diana. I'm an Alpha.
Hi, Diana. Thanks for joining us today. Can you tell us a little bit about your diagnostic journey and what symptoms led you to first seek medical care?
I had symptoms from a very, very early age. Severe asthma, bronchitis, pneumonia. I can barely remember being in the hospital at 4 years old in ICU in the oxygen tent with the ice under my head, double pneumonia. And I can remember multiple times after that I was in the hospital when I was 11 with pneumonia. Probably again in my early 20s, just asthma, pneumonia, bronchitis over and over and over again. And then I was in the ICU again in my early 30s with severe asthma. So I had quite a few symptoms constantly, but I thought it was just asthma. When we lived in Texas, I had gone to see a pulmonary specialist, and she told me that I had emphysema. I was 29 years old, but that's all. She just told me I had emphysema. Well, I hate to admit it, but I did smoke some back then. And of course, I quit, not at that point, but when I was right after that last visit to the ICU, I quit smoking. Thank God for that. I knew I was pretty sick after that last ICU visit with the asthma, and I happened to have a son. My youngest son also had severe asthma, and I was taking him back and forth to the pediatrician all the time, and just he was getting worse and worse. And finally, one night, we had a terrible time. He woke up, he couldn't breathe, he stopped breathing. My husband had to revive him. And after that, I said, I'm done. Thank God he survived. We made an appointment and took him to an asthma and allergy specialist, which I probably should have done before that. And after he got my son under control, I thought, well, maybe I should see him too because my asthma is so bad. So I made an appointment and went, and he did some blood work and breathing tests. And he said, you have this very rare disease called Alpha-1 antitrypsin deficiency. Of course, I'd never heard of it. He said he had just come back from an out-of-state conference and heard about this really rare disease. And he said, you look so sick, I thought you were going to die in my office. So I decided to test you for it. So I didn't even know I'd been tested, but I had. I was his first test and his first ZZ alpha. So it was pretty amazing that I was able to get diagnosed at that young of an age.
So before this appointment, Diana, had you ever heard about Alpha-1 antitrypsin deficiency?
My physician and I, neither one of us had ever heard of Alpha-1 before that week. So we really learned about it together. He said, I wanted to find out more about it. And he said, I went to my library, I guess a medical library. He said, I looked everywhere and this is all I could find. And he had copied an article out of a magazine. And he handed it across his desk to me. And he said, I'm so sorry. I'm going to do what I can and try to figure out what I can do to help you. But at this point, I don't know anything about it. It took him about a year probably. And he called me out of the blue at home one day and he said, Diana, I've heard about this new registry for Alpha-1 antitrypsin deficiency patients. And it's going to last about 7 years. And it's through the NIH. Would you like to participate? Would you be interested? And sure, absolutely. I figured that would give me education. It would give me resources. I'd get to meet at least one Alpha-1 physician because all of the registry sites were at major health centers. So he made an appointment for me to go to the University of Texas Health Science Center in Tyler, and that was the beginning. I got to meet Dr. Stocks, and got to meet other alphas because back then they were having what they were calling education days for the people that were in their registry. And from Texas, they had people from Louisiana, Texas, Arkansas, and Oklahoma in their area. And so they would invite all of us every year to come down, and they would bring in speakers and they would bring in vendors and they would serve us good food. And it was just great. I got to meet the most wonderful people that I would have never met otherwise, and really, really started getting involved. I was so fortunate to be diagnosed early and tested early. And I always felt a little bit guilty because not everybody gets that chance. And you know yourself, the earlier the diagnosis, the earlier the treatment, the earlier the lifestyle changes, the better quality of life a person's going to have. So, probably, I guess, about a year or so after I was diagnosed and got involved with the registry and just saw how important it was. And I basically ended up changing my life.
Alpha-1 antitrypsin deficiency is a genetic disease, and with any genetic disease, we know the importance of family testing. How did you navigate the conversation surrounding family testing with your loved ones?
After I was tested and we learned more about it, my husband got tested and he did not carry any genes for alpha-1. So we have two sons and we knew that they had to be one Z and one M, both of them. So we didn't even have to get them tested. I made sure my sisters got test kits, and one of them is an MZ and has some amount of lung disease, not serious like mine, but some amount of lung disease. My other sister, I got her a test, but I don't think she ever took it. As far as my family, my parents died at an early age and they didn't show any signs of lung disease, but they both had to have at least been a carrier. And my dad died of lung cancer at 47, so his lungs probably weren't that great. But my mom came from Finland. My dad came from Grant Parish, Louisiana, and they both carried the genes, so it's not as rare as people seem to think. I don't have any immediate relatives with Alpha-1. I encourage them to get tested. I really like to talk about testing, and that all goes back to awareness. If there's no awareness, there's no testing. It became extremely important to me after I started getting involved because I could see every day. I talk to people and see people that were hurting because they were not diagnosed early and they had severe disease by the time they were diagnosed. I was in pretty good shape. I mean, maybe I couldn't dance, or run too far or anything, but I could still do an awful lot of things. I was very, very fortunate. And it hurts me every time I meet somebody or talk to somebody that is already on oxygen, already having severe problems by the time they're diagnosed. It's not good. So I wish everybody would get involved with awareness and testing.
And Diana, what advice would you have for somebody who's newly diagnosed with COPD or Alpha-1?
I would tell them to immediately get involved. You're scared. You don't know what to expect, but go to a support group meeting or call a support group leader. Their names and numbers are on the Alpha-1 Foundation website. There's people to help everywhere, so many resources, and you make so many friends. There's no downside.
You mentioned volunteering as an advocate. If someone was interested in learning more about those opportunities, where would they go?
I know the COPD Foundation and the Alpha-1 Foundation are so involved with advocacy, with government agencies, with regulation to try to make everybody's life easier. And that's something we can do too. We can get involved with either or both, write letters, make calls, contact senators and representatives. It's a good thing to do. I know that there's been just years of hard work going into making those organizations what they are, and they have saved so many lives and working on, like John Walsh used to say, the C word, looking for the cure. So advocacy is extremely important, and awareness is a huge part of advocacy. If people aren't aware, they don't get tested, they don't get involved. It's just all so important, and I'm just so glad to be here and having had all those opportunities. When you start helping other people, it really, really makes you It really makes you feel good. It feels like you're doing something with your life, and it feels good to see other people getting the help they need. So advocacy is so important, not only between, for an individual and their personal health, and but also for advocating for things that helps the group.
Thank you so much, Diana, for sharing your journey with us. For more information about chronic lung conditions like COPD and alpha-1 antitrypsin deficiency and ways that you can get involved, visit the COPD Foundation website at copdfoundation.org.